and welcome back to the Uterine Nurse. So today we're gonna talk about and jump right into talking about how to decide what area to specialize in as a nurse practitioner. Okay, so let's jump right into it. Trying to decide what specialty you should go into as a nurse practitioner is hard, it's difficult. There's a lot of options. Our education is not streamlined, so there's lots of different specialties you can pick from. So I'm gonna try to help clear that up a little bit and make it a little bit more simpler for you to be able to make that decision. So for starters, I would start with trying to decide whether you wanna work inpatient or outpatient exclusively. I say exclusively because there are opportunities and ways to still be involved in patient care in an inpatient setting that doesn't involve you having to get acute care certification to do that. So you kind of have to decide, are you someone that for certain has no interest ever in being in a clinic? That's kind of like a decision that you kind of need to make. So I would start with that. That will dictate whether you do something that's primary care focused or something that's acute care exclusively focused. And it aligns with acute care. If you do decide you want to just do inpatient, there's a couple different options depending on what state you live in, what university you want to go to get your advanced education, on what specialties you can pick within that. But there's also the big outlier of that, which outside of patient management, there's anesthesia. And so that is a category in and of itself to be a CRNA, but you kind of know if you want to be a CRNA because you have to work in the ICU for at least 1 to 2 years before you can apply to even go back to school. So you kind of have a feel for that, and that's kind of its own little area. But if you're trying to decide as a nurse practitioner what to do outside of CRNA is, do you want to work inpatient or outpatient? The next area that you kind of need to ask yourself about is, do you want to deliver babies? And I know that's a big swing, but there's only, just like CRNA, a nurse anesthetist, there's only one way you're going to deliver babies as a nurse practitioner, as an advanced practice RN, and that's a midwife. So if you want to deliver babies, you need to be a midwife, and that's a hard kind of stop. So it's, do you have interest in anesthesia and anesthesia only, inpatient or outpatient, depending on whether you're going to do acute care or primary, or do you want to deliver babies? So I would start there. Well, now once you decide, I don't want to be involved with anesthesia, I don't want to deliver babies, and then you decide whether you want to do inpatient or outpatient. Let's say you decide you want to do outpatient. The big caveat a lot of people get hung up on, especially if they want to go into women's health area, which is the area I specialize in, is whether to do FNP or women's health. And that's been kind of like a debate of ages type of thing. I personally am an FNP, and I do not exclusively feel strongly about one or the other. I just think there are variables that you have to take into consideration if you're going to pick a primary care specialty and then specialize within that primary care specialty. There's variables you have to consider. So I would strongly consider you think about, if you do women's health exclusively, really consider if there was no other positions available in the area that you could do where you moved to, you know, extenuating circumstances and there was no women's health positions, the jobs had changed or you had to move locations, would you be willing to not work? Are you in a position where you can afford not to work and you just will not work regardless? If the answer to that is yes, then by all means, pursue women's health exclusively. If the answer to that is, I don't know, I don't feel totally confident that there is just women's health positions in my area, I don't feel totally confident that if there isn't an option, I can't afford to just not work at all, I would choose to go family medicine route. So that would be that's my take, like my 2 cents on whether to choose to do women's health exclusively if you know you want to work with women, or do family medicine. So that's kind of get down to the nitty gritty of that. Now, in family medicine, picking that specialty, you know that you're going to have, yes, a wide range of things and areas you can work in. And like I said, choosing that does not exclude you from being able to help out in surgery as first assisting, because as we know, nurses can first assist, so obviously nurse practitioners can. and it doesn't exclude you from helping out with hospital rounding for discharges. Now, you will not be doing any type of inpatient management or hospitalist work at all. And then you probably will not be taking care of patients if they are on very high acuity level floors. That would definitely be more for acute care nurse practitioners. There are a lot of programs that specialize in acute care that will like subspecialize in like cardiac, critical care, emergency medicine. And that's really a very personal thing for you to decide if that's something that you want to do. I personally would, unless again, similarly to the women's health, that you're willing to go unemployed if that position is not available, I would not pick anything like that to specifically focus on getting a certification. And I would probably do general acute care, because then you can work in the ICU, in the ER, in like cardiac surgery, like other more acute based things. So that's kind of how I would break it down. And I think if you look at it like that, then you really can kind of weed out pretty quickly what area you need to go in. You're not really making an emotional decision. It's more so you're making a very functional, practical decision. Because regardless, at the end of the day, you're going to get to your goal. So there's no need to overthink it and boggle it down. It's very straightforward and streamlined. So just in summary, we decided if you know you want to deliver babies, be a midwife. You cannot do it anything else. If you know you want to work in anesthesia, be a CRNA. You cannot do it in anything else. The primary and acute, there are ranges. So if you know you only want to work women's health and you're willing to be unemployed, if there are no women's health positions, then do women's health. And the same goes if you decide you want to subspecialize in acute care and something like ER, critical care, and some of those programs that are kind of sprinkled throughout the country. If you want to do inpatient, do acute care. If you want to do outpatient, do F&P. I hope this was helpful, and it just kind of took the emotion out of it and made it very simple and easy to pick apart.